A prompt and precise diagnosis in a patient with Duchenne muscular dystrophy is extremely important. This is a genetic disease, so first of all, it's very important to have a definite diagnosis so the patient don't undergo unnecessary tests. Sometimes, you know, a very important test is CK, that's a blood test, and CPKs are always very elevated in Duchenne muscular dystrophy, and that's a test that can point you in the right direction to say, you know, this is a muscular dystrophy. And then you really need to proceed with genetic confirmation because, of course, there are many other muscular dystrophy that can present similarly to Duchenne, like limb-girdle muscular dystrophy, congenital muscular dystrophy. So a prompt genetic testing, the nowadays is really like 95 or more sensitive to confirm the diagnosis is very important. Obviously, for genetic counseling, for the family to educate about risk in subsequent pregnancy, to have other children affected by the disease, but also is extremely important because although standard of care and corticosteroids are good treatment for all Duchenne muscular dystrophy patients, there are now other more genetic specific treatment that are really targeted to specific subgroup of Duchenne patient, and that are only applicable to a portion of patient depending on their precise genetic mutations. So gene testing to confirm the diagnosis is, yeah, so this is a very serious diagnosis. This is a disease that is universally progressive. It's a disease that will cause loss of ambulation, so these children will end up in a wheelchair, usually in their teenagers, late teenager years. So it's very tragic in a way for family to learn about this diagnosis and to really cope with what the long journey of living with this disease. So usually when we make the diagnosis of Duchenne muscular dystrophy, it's very important to have a genetic counselor to really explain the risk, but also it's also important to have, as part of the multidisciplinary team, also more support. Usually it's in the form of a social worker, nurse practitioner, the doctor, of course, and also very, very important to tell the patients and the family there are patients organizations where patients and family can actually meet other families, other children with this disease at different stages of the journey with the disease, so they can really become empowered, educated, and know that living with this disease is in fact very much possible, so that they don't feel isolated and alone with this serious diagnosis.